Imagine this. You're in your medical school interview, and the examiner says, a Jehovah's Witness is refusing a life saving blood transfusion. What would you do? Would you know how to answer? If you're thinking, probably not, or you're not 100% confident, don't worry. Ethical scenarios like this are designed to test your decision making, and they show up in almost every medical school interview. But the good news, there's a simple, structured way to approach them. Hi, everyone, and welcome. I'm Diba, and I've been helping students pass their medical school interviews for over 17 years. Let me outline what we're covering today. First, I'll give you a rundown of the 4 pillars of medical ethics and the 3 C's. I'll keep it straightforward and practical. Then, I'll introduce you to what I call the RAMP method, a 4-step approach that gives structure to your ethics answers. We'll then apply this method to a challenging scenario about Jehovah's Witness refusing blood, walking through each step in detail so you can see exactly how it works. I've added timestamps in the description so you can easily revisit any section when you're preparing for your interviews. Let's start with the basics. First up is autonomy. This simply means patients have the right to decide what happens to their own body. It's like respecting someone's personal space. You wouldn't force someone to do something they don't want to do. And similarly, you can't force medical treatment on someone who doesn't want it. Autonomy doesn't mean patients can demand any treatment they fancy. It just means they can refuse what's offered. Next is beneficence. This means acting in the patient's best interest. But here's where it gets tricky. What doctors think is best might not match what patients think is best for themselves. Different people have different priorities and values that affect what they consider beneficial. Then there's non-maleficence, which means do no harm. Every treatment has risks, so doctors are constantly weighing potential benefits against potential harms. Sometimes these principles can conflict. An operation might cause short-term harm, such as pain and recovery time, but long-term benefits, such as fixing the actual problem. Finally, justice. A fair distribution of resources. Imagine 3 people watching a baseball game from behind a fence. One is tall, one is medium height, and one is short. If each gets 1 box to stand on, the shortest still can't see. True justice would distribute the boxes based on need. The tallest person might not need a box, while the shortest might need 2 boxes. Healthcare resources work the same way. We distribute based on need, not just equally. Now for the 3 C's. These are practical concepts you will need to consider in ethical scenarios. Capacity is about a patient's ability to make informed decisions. For a patient to have capacity, they need to be able to understand information about treatment, retain that information long enough to make a decision, weigh up the pros and cons, and communicate their choice back. 2 critical points about capacity. First, it's time specific. A patient might have capacity now and lose it later due to medication, worsening illness, or even time of day. Second, it's decision specific. A patient might have capacity for simple decisions like what to eat, but not for complex medical choices. We should not assume that because someone lacks capacity for one decision, they lack it for all decisions. Consent means patients agree to treatment with full understanding of what's involved. This includes knowing the nature of the treatment, the expected benefits, the potential risks, and any reasonable alternatives. Consent must be voluntary. Patients shouldn't feel pressured or coerced, or the consent may not be valid. Confidentiality means keeping patient information private. Healthcare professionals have a duty to protect patients' medical information, though there are some specific situations where confidentiality might be breached, like if there is a risk to public safety. That covers the essentials. But here is where most candidates go wrong. They learn these concepts but don't know how to apply them in a structured way. I developed a system that helped me tremendously, and that's the system I'm going to share with you today. I call it the RAMP method. It's just 4 simple steps that you can apply to any ethics questions. R stands for recognize. Recognize the ethical issues. Identify the core dilemma and who is affected. A is for apply ethical principles. Use the 4 pillars and 3 C's we just discussed to analyze the situation. M means multi-perspective analysis. Consider different viewpoints, including the patient, healthcare system, and wider society. P stands for practical conclusion. What would you actually do in practice? Where would you get help? What's your justified decision? The ramp approach gives you a clear pathway through even the most complex ethical dilemma, ensuring you don't miss any important considerations along the way. Now, let's see how this works in our scenario. A Jehovah's Witness patient is rapidly losing blood after an accident and refuses a blood transfusion due to religious belief. First, let's recognize the ethical issues. The core dilemma here is the tension between respecting the patient's religious beliefs and the medical team's duty to save life. The main stakeholders include the patient, their family, the treating doctors and nurses, and potentially the wider hospital if the case becomes complex. The fundamental question is whether to honor the patient's refusal of treatment even when it could lead to their death. Next, we apply the ethical principles in detail. Starting with autonomy. If the patient has capacity, they have a legal and ethical right to refuse treatment, even life-saving treatment. Jehovah's Witnesses typically refuse blood transfusions based on their interpretation of biblical passages that prohibit consuming blood. This is a deeply held religious belief, not just a preference. For beneficence and non-maleficence, we need to think more broadly than just physical health. While giving blood would physically benefit the patient by preventing death, we must consider overall well-being. For a Jehovah's Witness, receiving blood against their will could cause profound spiritual and psychological distress. Some patients might genuinely consider this worse than death because of their belief in eternal consequences. So what constitutes benefit and harm becomes complex and personal. Regarding the 3 C's, capacity assessment is absolutely essential in this scenario. Blood loss can affect cognitive function, so the patient's capacity might fluctuate and deteriorate. We need to determine, did the patient have capacity when they refuse blood? Do they still have capacity now? If they lose consciousness, do they have an advance directive or a card stating their wishes? Consent is closely tied to capacity here. If the patient has capacity and refuses, this refusal must be respected if it's informed. They understand they might die without blood, and voluntary. For multi-perspective analysis, we need to consider several viewpoints. From the patient's perspective, their religious beliefs are fundamental to their identity and spiritual well-being. Their concern might not just be about this life, but about eternal consequences according to their faith. From the doctor's perspective, there is an instinct and professional obligation to preserve life, which creates significant moral distress when unable to provide life-saving treatment. Doctors may also worry about legal implications if they either respect or override the patient's wishes. From the family's perspective, they may share the patient's belief or might disagree and want treatment given. Either way, they're facing the potential loss of a loved one and experiencing extreme emotional distress. From a societal perspective, we value both religious freedom and the sanctity of life. Different societies might balance these differently, but modern healthcare systems ultimately prioritize patient autonomy when capacity exists. Finally, for our practical conclusion, I'd like to outline specific steps. First, I would assess the patient's capacity through careful discussion. If blood loss is significant, I'd regularly reassess as their condition changes. I would explore whether the patient has any advance directive or card indicating their wishes and check if they have designated someone to make decisions if they lose capacity. I would thoroughly explain the consequences of refusing blood, ensuring the patient understands the likelihood of death without transfusion. I would investigate alternative treatments that might be acceptable to Jehovah's Witnesses. Many will accept non-blood volume expanders, certain blood fractions, or blood conservation techniques. This shows respect for their beliefs while still trying to provide treatment. I would consult senior colleagues, the hospital ethics committee, and legal advisors if available. If the patient has capacity and maintains their refusal after full discussions of the risk, I would respect their decision while continuing to provide all other appropriate care. I would document everything thoroughly, including the capacity assessment and information provided about risk. So in summary, using the RAMP method gives us a comprehensive, structured approach to this difficult ethical scenario. Now let's look at how this might sound in an actual interview.
This is a really tricky situation because there's a clear conflict between respecting the patient's autonomy and the doctor's instinct and duty to preserve life. I think the key people involved here would be the patient, their family, the medical team, and possibly the hospital's ethics or legal team if things became more complex. The first thing I'd do is check if the patient has capacity. Since they are losing blood, that could impact how clearly they're thinking, so I'd need to assess whether they can properly understand the risks and consequences of refusing treatment. If they do have capacity, then legally and ethically, they have the right to refuse, even if it puts their life at risk. I just want to be sure they fully understand the situation, that their decision is voluntary, and that they are not being pressured by anyone. I'd also check if they have an advance directive or a Jehovah's Witness card that makes their wishes clear. But I wouldn't stop there. I'd want to explore whether there are any alternative treatments. Some Jehovah's Witnesses accept certain blood products like volume expanders or blood fractions, so I'd discuss those options to see if we could find something they're comfortable with. I'd also need to think about different perspectives here. From the patient's point of view, this isn't just a medical decision, it's a deeply personal and religious one, and they may see refusing blood as essential to their faith. From the doctor's perspective, this is difficult because we train to do everything we can to save a life, so it can feel really uncomfortable to step back when we know a transfusion could help. The family might also have mixed opinions. Some may support the patient's beliefs, while others may want us to intervene to save their life. And from a legal and ethical perspective, if the patient has capacity, their decision must be respected, but if capacity is unclear, we may need legal input before making a final call. At the same time, I wouldn't just rely on my own judgment. I'd consult with senior doctors and the hospital's ethics team to make sure we're approaching this the right way. And if there was any uncertainty about capacity, I'd check with legal advisors to see if any additional steps were needed. Another really important thing would be the way I communicate with the patient. I'd want to make sure they feel heard, respected, and not judged, even if their decision is difficult for the medical team. It's not just about the medical facts, it's also about trust and making sure they feel supported throughout the process. And finally, I'd make sure everything was properly documented: our discussions, the patient's capacity assessment, their final decision, and any input from the ethics or legal teams, so there's a clear record of how the decision was reached. So, overall, if the patient has capacity and fully understands the consequences of their decision, I would respect their autonomy while still doing everything I can to support them.
You now have the RAMP method, a simple but powerful framework that's helped thousands of my students tackle even the toughest ethics questions. Thank you so much for watching, and remember, with the right approach, the tricky ethics questions can actually become your opportunity to stand out from other candidates. I'm Dr. Deepa Jiva, and I'll see you in the next one.